Occupy Wall Street has become a global event. We're seeing it in thousands of cities now across the globe in close to 100 countries. And yet our mainstream press is not giving it as much attention as it could. Yet there's a lot of activity going on with Occupy Wall Street. And what is it about? It's about the corporate greed and corporate democracy that we have today, where the 1% of the wealthy are controlling the 99% of the middle and lower classes. And the question is who's behind this movement that's going on that's called Occupy Wall Street? Certainly, it's the people in the world who are disgruntled with what's happening and want to do something about it. What we have to be careful of is that it's not taken away from us by having other people who are in the 1% start to participate in Occupy Wall Street, cause some of the violence that can be caused very quickly, and lead it into a bloody mess. If that occurs, all kinds of possibilities come to mind that are worrisome. Things like the involvement of FEMA and martial law. Yet the movement is a good idea. It's something we want to support. We shouldn't have corporate America controlling every segment of our population, the business, the law, the medicine, the science, the sport. It's all integrally controlled by the 1%. And what can we do about changing that? Outrage is certainly the first thing to do, and it comes naturally, and that's happening now. However, outrage isn't really sufficient. What kind of action will we take? What can we do to stop the greed? What can we do to stop the corporate democracy that's now consuming us? A lot of that's going to come from grassroots level movements that are having us be the change we want to see. And it sounds so small, so insignificant. What can I do as an individual to make a change in how corporate democracy and corporate greed are causing all these problems in America? And so we get fed up and we retaliate. It's important that we have this kind of feeling out on the table, and it's really important that we have people learning about what's really happening all across America and across the globe. But at the same time, we should never forget that the first step of every journey, the first step of any meaningful change, comes from a single thought from a single person. And then it's walking our talk and showing what happens. Now, the reason I'm bringing this into focus today is because what are its effects on healthcare? You know, we started out 3 years ago talking about universal health care, like every other major industrialized country in the world has, where when you get sick, you get taken care of. And it's not like there aren't problems with that system. There are. There are waiting lists. There are people not getting taken care of in a timely way. There are insufficient funds to do a lot of the things that should be done. But those systems are probably working better than our country's system, because overall, we're ranked 37th in the world by the World Health Organization in the overall quality of care that we have today. So what do? We look at what's happened. Have we had health care reform really? Universal health care never had a chance. The health care reform that we had today, that we had 3 years ago, was an economic reform. And it was one that was purchased at the biggest steal of all time. For a measly $500 million, the business industry, the insurance industry, and Big Pharma were able to control what was happening in Congress so they could literally purchase the votes of the Congress people. $500 million, 525 Congress people, nearly $1 million per person. I would call that having strong suggestions for being bribed. So what do we do when we know that that's a situation? How do we change that? How do we go back to the grassroots level? What do we do to be able to empower some of these outrageous things that are happening and stop them in a way where we're not going to be just at a worse disadvantage? If we try to fight people with all the money and all the guns, we're obviously going to lose if we fight it on their level. If we evolve to a higher level of consciousness, we've got a chance. If we evolve to a place where we're interested in community and in being in situations where we're taking care of one another, where there's love and support and compassion, that would be a whole lot different than what we've got today. And if we built our community on values, like I just mentioned, lots of things that could change that would be different. When the heart of America has less money, has lost their homes, has fewer jobs, and has worsening health care, we're in a wrong track. And it's not just happening in health care, it's across every segment of our culture. Health care has been systematically dismantled over 25 years. This is no accident. I have watched this process develop. I wrote a chapter in my book, A Return to Healing, that talks about how well is healthcare working. It shows the dismantling effect as we brought HMO medicine into the mainstream, and where doctors sold their practices to hospitals or to giant organizations that would then own their practices within about 5 years and then tell them how they would practice. That's what's happened. And as we see more of that coming into effect, doctors are no longer able to do the things they could 50 years ago, where they can have judgment, clinical judgment, where they have time to listen and care to their patients, instead of protocols that are handed to them by people who are supposed to be experts and who are trying to make decisions about how to manage healthcare problems that are challenging, but keep it economically viable at the same time. This is not the kind of system that we want, but it's what's happening. So as we've dismantled the doctor and taken the doctor out of the picture for the most part, because we now work for somebody and we become employees, we've lost a lot. How do you regain that? Doctors could do that actually overnight if they agreed to not participate in HMO medicine. They agreed to do private practice. They agreed to put shingles up like we did 30 years ago when we came into clinical practice, and things developed on a very personal basis. So we need to realize what's happened, that it's been orchestrated very carefully, that we have lost the heart and soul of medicine, and that Occupy Wall Street is something that's very important to pay attention to, but not to get too carried away with in terms of it leading to potential violence and to potential actions that are taken by the government that could be very disturbing. So we need to hang in there. We need to start doing more than being outraged. We need to take action. We need to do that one person at a time. And if we do it one person at a time and people like what they see when they're watching what you do, you will have made an impact on them that will be very deep and compelling. That's the action I think we need to take. We don't need to stand for what's happening on Wall Street. We don't need to stand for what's happening in Congress. We do need to stand up for ourselves at the grassroots level. And maybe the action that's happening on Wall Street now will be something that will be to our advantage and something that will change how medicine and how our culture is managed.